Thanks for joining me, everyone. Charles Moscowitz, welcome to the program. Heard live every afternoon, 12 noon Eastern Standard Time on YouTube and on subscribing platforms. Dylan Howard is my guest. Dylan is he's an investigative reporter. He's known as the Scourge of Hollywood. He's written some amazing books on Hollywood, on the British royal family, the royals. He just wrote COVID-19, the greatest cover-up in history, from Wuhan to the White House. Thanks for joining me, Dylan.
It's good to be with you, Charles.
All right, so we're now seeing what appears to be a resurgence of the virus internationally. There's already talks about new lockdowns. There's already panicky news reports about hospitals filling up and a higher death toll. What is going on the ground right now from your research?
Well, I think we still have a very fractured United States of America. We have President-elect Joe Biden, who is inheriting probably the greatest humanitarian crisis that the world has seen. This is our World War III. And if anyone thought that there was no second wave imminent, then they were kidding themselves. The reality of the matter is that whichever way you look at this case, from China through to other Western democracies, there have been cover-ups time and time again. There have been cover-ups at the highest levels of health organizations, like the World Health Organization, whose culpability in this cannot be underestimated. But I think when you talk about what's happening on the ground here in the United States, we are devoid of a national policy or national mandate, one that is backed by science, that all states should be abiding by. Now, I understand that it is up to the individual states, but it shouldn't be upon ideological lines on how the virus is dealt with. And quite frankly, President Donald Trump has promoted that misinformation, that disinformation, in many cases, the lies, and that has spread confusion amongst the people of this country, where some people don't believe Dr. Anthony Fauci because his credibility is questioned. And that has undoubtedly ensured that the second wave has hit. I don't think it's on the precipice of hitting. It's hit, and hundreds of thousands of people risk losing their lives based on the models and forecasting, unless President-elect Joe Biden, who I'm no apologist for, implements some form of strategy that counters that of the current administration.
Well, first of all, just as a technical matter, Joe Biden is not the president-elect yet. That has to be certified by the 50 states. So right now we have a situation similar to the two popes. There's right. So we don't know who the next president is going to be until the certification. The Anthony Fauci has said in, I think it was maybe mid-October, that we're going to be stuck with this thing and it's going to change the course of life right up through 2022. And yet he just came out with a statement yesterday saying that because of the sudden discovery of a vaccine, which apparently they knew about many weeks ago, but didn't mention because they thought it might help Trump, that it could be over as soon as January or February, once we have enough vaccines out there and in people's hands. So, Dylan, what is the status right now of the vaccine? Is this a good vaccine? And what do you project in terms of its applicability?
Look, I think there are so many different companies that are working on potential vaccines that it could only be a good thing. It beggars belief to me that it takes 9 months with the best scientific minds in the world today to find a vaccine for the spread of this deadly virus. I don't think we should necessarily be criticizing Anthony Fauci regarding the Pfizer announcement that it is close
Hmm.
to this test. This vaccine. This vaccine is very similar to that cocktail that the president took when he was infected with the
Diagnosed.
virus. But the spread of the vaccine is going to take some time. It's in hot demand, as you can only imagine, not just here, but in every country. And there is going to be a supply problem, a supply chain problem to be able to meet the demand. Not every American is going to get their hands on a vaccine. And I spoke to someone inside the administration recently who said, we really should be looking at summer 2021 as sort of the get out of jail free card, if you like. Well, it's not free because
Hmm.
hundreds of thousands of lives have already been taken as a result of the silent killer.
Yeah, I mean, I think that's probably seems right only because from people I've interviewed that it's not so much the vaccine, but it's the transportation of it. It has to be in 90-degree below zero refrigeration, and just to get this thing out there and in the right hands and finally to the public is a huge operation. It's not so easy. It doesn't happen overnight. Meanwhile, the Russians say they've got a vaccine that doesn't need refrigeration at all. Um, is that something that can be trusted? Are they using that at this point? Has Putin taken it?
We don't know. I mean, Russia is very secretive about what it does and what it's been doing. Um, it's also incredibly unlikely that they would share it with the world. I would not put too much faith in uh, the Russian administration to be cooperative in presenting the vaccine. I think we should rely upon the institutions in America. I think that there are so many different trials that are going underway at the moment that there is light at the end of the tunnel. But you've also got to weigh the fact that there are going to be supply chain issues in the distribution of a vaccine against the fact that we're going into an environment now in fall through to winter in which more people are going to be indoors, more people are going to be close together with Thanksgiving. And if you look at what happened in Canada for their Thanksgiving that was earlier this month, they've seen a steady increase in the amount of cases as a result of people congregating and celebrating the holiday together. So by no means are we out of the woods. I think things are going to get worse before they get better. And that may still well include the fact that there is a vaccine in the marketplace. I don't think that it's going to negate the situation 100% immediately. I think we're going to be faced with a dual problem, getting that vaccine into the hands of those that need it the most, and at the same time, trying to minimize the spread in the second wave.
Also, the disease itself, I don't know if it's whether the disease itself has changed due to mutation or whether treatments have improved, but it doesn't quite seem to be the death penalty that it was, and it seems to be much more manageable. I mean, case in point is Donald Trump himself, who got the disease and recovered within a week, week and a half, and likewise a lot of his top aides who caught the disease and also recovered, including his wife and including Kayleigh McEnany, this press secretary, and a list of others. And in the case of Trump, he took this cocktail. Is that something that is, proven to be effective, and is it being made available?
Some medical professionals believe it is effective. There is no concrete evidence that it is, but clearly, anecdotally, it seemed to work for the president. It's not a miracle cure as it has been described, but certainly it's a mitigation of the disease. And that was beneficial to President Trump. But I think each patient is an individual case by case scenario.
I see.
Um, I think that to your point about the deadliness of the virus, I mean, I think the risk still is there. This is, at the moment, an untreatable ironclad disease. However, I think what we found is when the virus first hit American shores, that those that were more susceptible to contracting the virus, those with a lower immune system or pre-existing conditions, were the ones that were perhaps most affected early on. And the mortality rate for those people is obviously higher than those that are not. So in that particular instance, then those people were more susceptible to death. The other factor to consider is we're also testing more now. We weren't testing nearly as much as what we should have been at the initial outbreak of the pandemic. Now we're testing more. So there is a direct correlation between testing more and understanding that there are more cases of the virus.
Right, sure. The more testing you do, the more, and also sometimes there's been some information about the testing itself in terms of really ramping up the level of virus that one might have, and someone can have just a tiny drop of the virus and be completely asymptomatic, but they're listed as having the virus, and that someone could die in the hospital of various normal diseases like cancer or heart disease, but if they had any of the virus, it's listed as a death due to the virus. So this is how a lot of the recording of this is done, and it's done in a way that seems to promote the virus maybe bigger than what it is. Now, I'm not here to say that it's not a serious problem. I mean, I'm taking precautions just like everyone else, but another statistic that came out, the CDC indicated that the death rate for the virus is less than 1% until you reach over the age of 80, in which case it goes up to maybe to 2, 3, 4%. So, these are just certain aspects of this which we should put into perspective as we proceed cautiously and carefully with the functions of everyday life.
No doubt, no doubt. I think we're in a very different situation come November today than where we were in March and April. And the book charts the rise of the virus through until sort of July. And obviously, we went to print and we couldn't continually report the book out as it went to print. But what it does establish is that there were missteps and mishandling of the virus at the very start. And it originated in China with the Communist Party and how they tried to silence whistleblowers who raised the alarm about the COVID-19 virus, suggesting that it was a SARS-like virus. Instead of taking doctors' words seriously, the Chinese Communist Party detained these people and made them rescind their position. Ultimately, the great whistleblower of this, Dr. Li in Wuhan, was the first doctor to raise the alarm. He was detained and disciplined by the Communist Party, forced to retract his statements, and sadly ended up dying of the virus. But the culpability of the Chinese Communist Party doesn't rest there. This is an organization that on January 14 told the World Health Organization, an organization that I should say has blood on its hands due to its mishandling of the virus, that this virus was not a human-to-human transmission. Yet
That's
Taiwan,
really
who had done its own research, said that it was.
And they waited something like 5 weeks before they finally admitted that it was. And during that time, you had people emanating from China who might have been carrying it to the four corners of the world. And there's been speculation that the WTO was colluding with China.
Well, I think the World Health Organization, its pockets are lined by China. This is an organization that I think in 2003, with the SARS outbreak, was highly critical of the Chinese Communist Party. Now, all of a sudden, is praising the Chinese Communist Party. And one must question why they were doing that and taking at face value what the Communist Party said as fact, when in reality, they were lies. And the World Health Organization just like the federal government here, in my view, has a duty and obligation to protect the citizens of the world. The federal government has a duty and obligation here in the United States and in every country. The federal government has a duty and obligation to protect the individuals of their respective countries. Instead, here in America, the virus became weaponized as a political measure for both blue and red. And that's proven by the fact that exit polls in the election said that the two most important issues to both liberal, to Democratic voters and also Republican voters was the economy and the handling of the COVID virus. So when the president of the United States is disavowing the advice of someone like Dr. Anthony Fauci, it poses problems because people don't necessarily then believe Dr. Anthony Fauci, call into question his credibility, his authenticity, his credentials, and it sows confusion amongst the public. And I think that's a very dangerous situation, as is the fact that there is no federal mandate on how to deal with the pandemic. If there was, I think that more lives would have been saved than we have seen lost as a result of this virus. That's not a political statement or anything that is designed to stab Donald Trump in the back. It's just a simple reality that
Right.
Donald Trump treated the virus with a lack of respect. And as a result, people's lives were lost.
Well, look, I think that the federal government should have had a little bit more of a coherent policy
No
in terms
doubt.
of advice, but I don't know if they have the authority to have a federal mandate. I mean, that is something that's up to the states unless they want to declare martial law.
They
And
would not have been able to declare martial law, and Americans wouldn't have allowed or stood for that. But there
right,
could have been a best practices policy that was encouraged upon the governors, as opposed to saying you make up your own rules.
no, that's
And of
right. They could have
course,
had a more clear national guideline. I think they did have it, but it wasn't clearly articulated. And when Trump originally called for banning travel from China and then from Italy and Europe, he was roundly attacked by, this is very partisan, as being racist and xenophobic. I remember listening to that and knowing that there was something askew with that, and that just go on out, don't pay any attention to this. So, there's plenty of finger pointing that could be done on both sides. But the fact is that we now know that reasonable steps can be taken by reasonable people to reduce your exposure to the virus, including wearing the mask inside when you go inside a location. I would dispute whether when you're outside, and making sure that you use you use proper sanitation. It's also been said that gargling with mouthwash is not a bad idea either, and a couple of other things. Being healthier, vitamin D, vitamin C, maybe making sure that you're taking care of your health. And I think that we can get by because at the same time we need to continue to function.
look, what I would say is I'm not a medical professional.
Right.
I'm not here to provide advice on how to deal with mitigating the potential risk that one might face. What I have done, though, is that I've spent hundreds of hours analyzing how the government has dealt with this particular scenario, and I'm left unambiguously to state that the virus was weaponized in the election. There was a 57-page dossier that was sent out by GOP operatives to election candidates, encouraging them to continue with the conspiracy theory that this was somehow a virus that was leaked from a Chinese lab. That's simply not the case. It originated at a wet market. I don't know if you've ever been to a wet market, but you can get any type of animal that you want in China at a wet market. And that spread of misinformation caused unnecessary loss of life in the United States. And for that, I do believe that government office holders needed to be held to account. And to your point, the election has not necessarily been resolved at this point. But if Donald Trump is a one-term president, I think the sole reason will be, as the exit polls showed, that people were not happy with his handling of the coronavirus, and that
Well,
contributed to his loss.
I think a lot of those people who would have been viewed as unhappy with the coronavirus may have been people who passed away many years ago, and also some people's cats and others might have
I,
been unhappy. But
I,
putting
I,
that aside, all right,
I, I hope you're saying that with a tongue in cheek,
right. No,
because
this is remains to be seen, and there's the Dominion.
let's wait. Let's wait and see for the evidence.
Let's
Look,
wait and see.
I am no Biden apologist. I
Understood.
am no Trump apologist.
But
I would
these things
like to
need
see
to
the
be
evidence.
investigated and investigated very quickly. And if it turns out that there was nothing to it, then fine. I want to just switch gears a little bit here. Again, Dylan Howard is the author of COVID-19, the greatest cover up in history from Wuhan to the White House. Dylan, you're also the author of the book Royals, and my wife is a big follower of the Royals. She
Excellent.
wants me to ask you, what is the deal with Meghan Markle and Harry asking the royal family to place a wreath for them, and then the royal family refusing to do it? What's going? Is their relationship that strained at this point?
Yeah, it is. There was a time in between their decision to abdicate from the royal family and early on in the coronavirus that things seemingly were back on track, according to my sources, that he was talking to his brother, Prince William. His father, of course, had contracted COVID-19. We now know William had contracted COVID-19. Prince Philip had contracted COVID-19. That brought Harry closer to his family, at least in communication, as he was in Los Angeles and they were in England.
Mhm.
But what has happened since then is a series of actions that are inconsistent with how the royal family operates. They view the media and the tabloid press as beneath them and not warranting any response. Meghan Markle, on the other hand, believes that she should be a zealous advocate for her own position and filed litigation against Associated Newspaper Group, the Mail Group in the UK, and in many ways aired the royal family's dirty laundry. She said that in many ways she felt discriminated and that the royal family did nothing to stick up for her as she was attacked in the press. The reverberations as a result of those court filings are still being felt at Buckingham Palace. That is not what the royals do. The royals are above mudslinging, and Harry and Meghan have resorted to this in a court of law at the detriment of the reputation of the royal family. And there is a lot of ill will now towards them as a result of that litigation, of which Meghan has not necessarily been so successful to date in that case. So the damage, the collateral damage done as a result of it could be quite significant.
Well, I would think so. I mean, when you start, lodging lawsuits that involve your own family, that's not exactly, a chance to sing "Kumbaya" and wiggle your toes around a campfire. Um,
It
I
also
also,
raises questions about Harry and his view of the royal family. Here
uh,
is someone who clearly believes that the royals and Prince Charles were at least culpable in the way in which Diana, his mother, was treated by the press and
right.
hounded by the press. And I think he still has a level of resentment. In fact, I know he still has a level of resentment surrounding the death of his mother. But he's obviously abdicated not only from the royal family, but procedures and protocols and pomp and circumstance that surrounds the royal family. He allowed Meghan to do this court filing, this litigation, which goes against the very nature of what the House of Windsor stands for.
Right. So they must not be none too thrilled with that. I also want to ask you, I know this sounds like a tabloid type question, and I don't mean it to, but it's been out there for a long time, and there's been pictures that indicate that this might be the case, and that is the question of the paternity of Prince Harry. What's the deal with that?
Look, it's been the long simmering rumor surrounding Prince Harry for decades. Allegations that James Hewitt, who was a
Right.
former army general in the UK, may have been his father. The dates simply don't line up to suggest that he could quite well be the father of Prince Harry. Um, it is good tabloid fodder, as you mentioned, but
There's
all
an
evidence
awful
points.
striking family resemblance there.
Look, there is a striking family resemblance not only to James Hewitt, but another red-headed gentleman who spends a lot of time with Prince Harry. But that doesn't necessarily mean that he's
Understood.
not the birth child of Prince Charles.
Understood. And then I also want to ask you about your book on Epstein. We had talked about this last time. We talked about his interconnection with the international possible trafficking rings. I don't think it's controversial to say that was involved in that. Pedophile rings and that kind of thing. Is there anything new breaking on that story? We know that Maxwell is being held under suicide watch in New York. Um, do we know anything about what she's up to, and what do you have on that?
Well, I firmly believed that with the arrest of Ghislaine Maxwell, that the Southern District of New York's investigation was ultimately over. They had achieved the highest target post Jeffrey Epstein's suicide. I am wrong. The SDNY and the FBI continue to investigate this case and continue to set their sights on alleged co conspirators who helped enable Epstein and Maxwell and other individuals that could have been involved in underage sex. The SDNY had said in the wake of Ghislaine Maxwell that effectively the case had reached its climax, if you like. That simply wasn't the case. As I understand it, one key witness in the case, an alleged co conspirator, has actually fled to an international country where there is no extradition treaty with her husband. Such is their concern that this individual would be prosecuted as an accessory to these crimes. In addition to that, the government has said that they want to talk to Prince Andrew. Prince Andrew has said that he's volunteered to cooperate. The government says that's simply not the case. About a week or two ago, there was a lot of rumors circulating that maybe Prince Andrew had cooperated with authorities and answered questions. That turned out to be not correct. And in fact, his legal team vehemently denied that. So I think that this book has not closed with regards to further prosecutions. However, as I've said to you previously, when you look down the rabbit hole, you should be concerned about what you might find, because you might find something that's even more sinister.
Mm-hmm.
And beneath this story lies a very controversial story, being that of the US government's knowledge of Epstein and Maxwell operating this child sex trafficking ring and espionage ring on American soil, seemingly without impunity.
Right, and there are a lot of rumors about this being sort of a honey trap for international uh, leaders, both political and business, and intersectionality with other intelligence assets like MI5 or the Mossad and other groups. Um, Last time I had you here, I asked you about these rumors that are very persistent with regard to pedophile rings or whatever you want to call it, or activity in Hollywood and amongst many of our sort of entertainment elites, particularly and including some of these late night talk show hosts, which we won't name, and others. And I mentioned with relation to that the death or suicide of Isaac Cappy and his testimony before he died, which is available on YouTube. Have you had a chance to look into that at all?
Fortunately, I was working on the COVID book, Charles, but you have reminded me, and that is going to be something that I have on my list to do. I mean, I have certainly been investigating sexual crimes in Hollywood for some time.
Right.
I was the first to report the story of Charlie Sheen having HIV and having unprotected sex with individuals under utilizing effectively a sex contract that meant that those individuals couldn't sue him and they had to go to arbitration.
Mhm.
So it's not foreign to me about the allegations about sexual impropriety of people in Hollywood. Inevitably, sadly, to make a global view of this, um, inevitably, when people have power, wealth, and access, um, if they have a peccadillo in their closet, then they're likely to use their means to be able to justify their desires. And the alleged child sex abuse of young actors is certainly something that has been percolating in Hollywood for some time. There have been allegations about certain individuals, but it has been threadbare on proof. That said, um, maybe it's time for a Dylan Howard investigation.
Well, Dylan, you're the man to do it. I'll tell you that. I mean, you've got your hand in a lot of things out there. It is obviously a very difficult procedure because, again, as you say, you're dealing with people who are extremely wealthy and they've got a lot of power, and they can make things change and make things appear. They're in the whole business of illusion, anyways. So they can create a public illusion around this whole thing. So anyway, Dylan, listen, I want to thank you for joining me as always. Let's stay in touch, and again, the let people know the book.
www.wuhantothewhitehouse.com, and it's available in hardback, I believe, if I look at today's date, in 5 days. So the ebook is available at wuhantothewhitehouse.com, and in 5 days, the hardback cover version of the book will be available at all good bookstores, Amazon, and Barnes and Noble.
Excellent. I'll put a link up to it as well. Thanks a lot, Dylan. Have a great
Good to see you
afternoon.
again, Charles.
All
Take
right,
care.
take care.